In terms of dealing with mismanaged care transitions, it's obvious. I can't keep track of all these administrative details in practice medicine at the same time. Again, the subspecialists are used, many of them used to having their own world. Patients come in, they get the procedure that they're supposed to get. You do an excellent job with it. You discharge them to what you think is a healthcare system, but it isn't. And so what is a subspecialist supposed to do about that? First of all, make sure that the hospital is providing the services to you as a subspecialist that they're required to provide through Medicare. If you read the Medicare regulations, the hospitals are supposed to be providing all sorts of care management and care and transition services, pharmacists, social workers, and care managers of all sorts. So make sure that they're getting what they're supposed to be getting from the hospital, and that will really be of help to them. Helping them understand, looking at a map like this, where the weaknesses are in the system, and getting together with other colleagues at the hospital to improve care in that particular region. And again, as I mentioned, the surgical organizations have put together what's called ERAs, or Enhanced Recovery After Surgery programs, where they literally map out the pathways of care, not starting with the procedures, but starting even before being in the hospital, understanding what the needs are. They invented a word, prehabilitation, of select patients. So mapping out what the care is, even if you're not the particular person who's handling it, you have a lot to say about, here's what I want done before I even see this patient. Here's what I want done after I discharge that patient from my care. So these, you can Google these and get a lot of information. We have some resources at the end to connect to these. I think there are at least 40 different eras now that are related to the work that surgical subspecialists do.